Welcome to the AEL tutorial on the benefits of AEL's anterior support product line. In this brief tutorial, we'll be discussing the differences and clinical benefits of AEL's stretch option, their non-stretch option, and AEL's zippered design. Prior to implementing any sort of anterior support, it is important to, again, as noted in other tutorials, it's important to address the position of the pelvis. Prior to implementing any type of anterior support, the evaluating individual should confirm that the pelvis is in as nice of a neutral position as possible, trying to eliminate or reduce any type of posterior pelvic tilt, where the top of the pelvis is tilted posteriorly, thus causing forward flexion and a kyphotic type presentation, and also trying to reduce or eliminate anterior pelvic tilt, where the top of the pelvis is tilted towards the front of the seating system. After attempting to ensure a neutral or as neutral as possible pelvic positioning, we can then move on to the anterior support option. Now, after deciding whether slim cut or standard cut is the best option for your client, it's now time to determine whether a stretch option, a non-stretch option, or a zippered design is in your client's best interest as well. There are some key differences between the stretch, the non-stretch, and the zippered design. In regards to the stretch, the nice thing about the stretch option is this is going to, because of its stretchability, okay, there is a little bit of stretch and adjustment capability here. Because of the stretch capability, it's going to provide your client with increased contact and increased engulfment within the anterior support. So when your client sits in this anterior support, when they're in their chair and they're sitting there with the anterior support in place, it's going to give a fully engulfing type of grasp and hold. The nice thing about the increased contact area is that it's going to provide your client with increased surface area distribution as well. What that means is when my client is in their wheelchair with this anterior support in place, because of the stretch option associated with it, it's going to give a better hold to the client, therefore putting the client not only in a better position, but also ensuring maximum hold and maximum grip of that client's trunk. This is also nice for clients who present with the risk of pressure-related issues or skin breakdown as a result of the support cutting in or becoming wrinkled or uncomfortable. With the stretch option, because of the full engulfment capability, we also see a reduction in the amount of cut-in or discomfort that's associated with its use. So that's a plus. In terms of the stretch option, another thing you may find is a little bit of improvement in regards to patient satisfaction. Because it is more of a stretch option, many clients will report that it is a more comfortable option to wear. The other thing to think about with the stretch option, sometimes as a clinician, you would like to have a client allowed to be able to reposition and move around within that seating system just a little bit. If that's the case, if you would like some adjustability and some accommodation to be had by your client, the stretch option will allow them a little bit of flex, a little bit of readjustment, and a little bit of fine-tuning within the actual seating system. So if you prefer that your client have the ability to reposition slightly or to do their weight shifts and pull away from the back just minimally, the stretch option will offer that capability for them. Moving on to the non-stretch option. In a situation where a non-stretch option is preferred, you may have a client who presents with a need to have a more rigid, solid, stable, less forgiving anterior support. This may be this may be needed for clients who maybe they have a diagnosis such as cerebral palsy, or a diagnosis where writhing motions are present many times, or if you have a client who's very mobile in their seating system and you don't want them to have that mobility, you'd rather them be very structured and very secured in their seating system without the opportunity for reposition or for flex or for the minimal amount of adjustability that the stretch offers. If you do not want your client to have that capability, the non-stretch option is going to be the better route. Now, specifically, there are some diagnoses in which tone is present. Okay, so if you have a diagnosis where tone is present, so there is hypertonicity, there are writhing motions, there are spastic or high tension motions that are occurring. A lot of times, if clients are allowed a little bit of mobility within the chair, that little bit of mobility exemplifies or exacerbates the tone that's occurring. So in a situation where you want to seriously limit the amount of actual mobility that the client holds in terms of trunk mobility, the non-stretch option may be the option for you. It's going to be a little bit more rigid. You're going to see less engulfment, so it's not going to wrap around the client and engulf the client as much as the stretch option would. The other thing is you may find that the client runs a little bit, fairly minor, but a little bit of risk of skin breakdown with the non-stretch option. The reason for that, like we touched on, with the stretch option will wrap around the client, will fully engulf, and will also fully equalize that pressure pretty easily. With a non-stretch option, if you have an area that is wrinkled, if you have an area where the client's sort of cutting in, because it doesn't offer a lot of stretch, you'll see less engulfment, and you may see a slight risk for some cutting in or some discomfort on behalf of the client. Again, very minimal, but if you want to eliminate that possibility, the stretch option is a more feasible one. Now, moving on to the zippered option. You may obtain a zippered option in either a stretch or a non-stretch design. The nice thing about the zippered option is the easy removal of the device. The device itself has a zippered front, so much like zipping up a jacket or zipping up a coat, your zippered design will allow easy removal, a quick release, and a very easy unzip out of the system option. This is going to be nice for clients who maybe are performing frequent transfers. This is also going to be nice for clients who maybe prefer more of a cosmetic feel. The nice thing about the zippered option is that for clients who aren't capable of reaching around and undoing the clasp that you see on the stretch and the non-stretch design, this release is right in front of them. They can very easily take their hand, grab that zipper, pull down, they're out of the system. If this zipper is too small for your clients to use, you can very easily add a pull onto there or add a larger grasp, a larger tag to allow a client to grab it who has some limited fine motor skills. But the nice thing about the zippered option, it's easy removal, it's immediate release, and for clients who do have some rotator cuff issues, maybe some shoulder arthritis, maybe their status post-CVA, they've had a stroke, they don't have the hand strength to work the clasp, the buckles that you see there. It's a very easy to remove type of device. It's also cosmetically friendly. Some clients prefer it because it is a little less medical in appearance as a result of the zippered front. Something to think about is if you have a client who has, again, significant weakness of the hands, they're not able to grasp the buckles, they don't have the pinch in those fingers to release those buckled options, the zippered option may be a more appropriate option to choose. Any of these options may be used with any of the diagnoses that we talked about during the standard cut versus slim cut tutorial. And those diagnoses include spinal cord injury, multiple sclerosis, muscular dystrophy, cerebral palsy, hypotonicity, any situation that presents with decreased trunk control, poor core strength, and a lack of general seating tolerance within the chair. For more information on AEL's product line, you may go to AEL's website, which is aelseating.com. Thank you for attending AEL's tutorial on the stretch versus non-stretch versus zippered option. And be sure to view our other tutorials at aelseating.com.